If you've been looking to improve your quality of life, you may have considered hormone therapy.
Who is a good candidate, and what are the benefits of taking a more natural approach?
Well, welcome back, Dr. K, Thatcher, Skyn Deep, and Sarpy Women's Health. Good to see you.
Thank you so much. Great to be
back.
back.
And I'm loving all of this today. We all kind of match here.
Yep.
We're kind of dark. We're kind of dark, and I know.
We're kind of dark.
Spice up these colors.
You're dark.
I'm dark.
We're bright and fun.
Anyway, listen, we're not talking about clothing today.
We're
talking about, we're focusing on bioidentical hormones.
Correct.
So when we use that term, we throw that around, what does it mean? What are they?
Bioidentical refers to the body's ability to recognize hormones that are already natural for the body. So it's what the body would normally produce in and of itself, as opposed to something synthetic where the body has to alter it. Or even we use the term natural sometimes. Natural is more natural from a plant standpoint, so it's derived and extracted from plants. But bioidentical hormones is something that the body already recognizes as its own. Sometimes these are actually coming from plants too, but it's in a process that the body does not have to convert it, where the body can use it.
Okay, so what are the symptoms that both men and women are facing where they would need to have this kind of a therapy?
Well, remember, bioidentical hormones or any type of hormone therapy is used for people that want to be able to restore the way they felt before they were entering transitional phases like menopause, or even for men, andropause. So certain symptoms include things like sleeplessness, fatigue, irritability, mood swings, mental fogginess as opposed to having mental clarity, difficulty with anxiety, and even some depression.
Okay.
So.
There are other, I mean, what some would consider more conventional types of hormones. I don't know if it's the synthetics or what it is, but how is the bioidentical different from those other previously what were considered traditional hormone therapy?
Well, the more traditional hormone therapies you'll find in pills, creams, lotions, and they are FDA approved. So pharmaceutical companies will make these, and they are synthetically derived. So for example, there's one out there called conjugated equine estrogen. Well, where does that come from?
It comes from horses?
From horses,
Right.
Exactly. There are others that are out there that are derived from plants. One is actually extracted from the yam plant. That's considered a natural form, but for the most part, a lot of them that are conventional, where there have been a lot of testing done from pharmaceutical companies, are primarily synthetic hormones.
Do you want to stay away from the synthetics? What do you, as a doctor, your medical opinion?
Well, that depends upon the individual. Some people do great on the synthetic hormones, and that's what they want to use. They feel better. There are other people that just don't want to use that.
Right.
You know, and it also depends upon the route that you take it in, by mouth, creams, lotions, or in the case of pellet therapy, it's actually placed in the subcutaneous fat in the buttocks. And so it's actually
those little
absorbed.
Tiny little.
Those are little tiny, yes, what you see here on screen, those are small little pellets. The bioidentical pellet therapy consists of either estrogen or testosterone. Women will usually be given either or both, okay? And you can see here, there's the skin, there's the fatty tissue and the muscle. And so it's just placed underneath the skin.
Is
with
this like
women,
a shot, kind of?
well,
Like, is it a
you do need to numb. You do need to numb the
okay.
patient, of course. And it's a very quick procedure done in the office. It takes the most maybe 5, maybe 10 minutes.
Yeah.
Men frequently are going to have a little bit of a longer procedure because they will require more testosterone pellets. So as a result, it's going to take a little bit longer. That therapy for men usually lasts about 6 months.
So the pellets go under the skin in that fatty part, kind of on your rump, right?
That's
right
exactly
on the backside, right?
And we usually alternate. So one time you come in, it'll be the right side. The next time it'll be the left side. And we keep alternating back and forth between the sides.
So let's talk about this again. How long do those results last?
So typically for women, we find that it lasts about 3 months. Usually by 4 months, they're clawing at the door, trying to get in as quickly as possible. For men, like I said, it usually lasts about 6 months. It also depends on how active someone is and how much an individual needs those hormones, because the body will actually absorb more of those hormones as they need it.
Yeah, when you determine a patient that can use these bioidentical, is there, how do you figure that out? Are there blood tests up front, or how does that work?
Yes, so we do blood tests. We also base it off of the patient's clinical signs and symptoms. And then it is calculated from a dosage standpoint. After we insert the pellets, we give it a little bit of time. We repeat the blood test, but we also ask, and this is of course the most important part, how do you feel?
Right.
Because that's the purpose of
yeah.
doing this, is to be able to give back someone their quality of life, their vitality.
Okay, now I don't think we got to this, and I don't want to sound like a dumb question, but do these pellets, are they dissolving in
Yes,
there?
they are. They're being absorbed.
Okay.
And the thing that makes this so nice is that it's a 24/7 process, as opposed to taking a pill or creams where it touches the skin or goes into the GI tract. Those levels really shoot up and then they come down, and they shoot up and they come down, versus pellet therapy where those levels come up and they stay constant, which is easier for the body
Right.
to be able to take.
Well, and then you don't have to remember to put the cream on or take the
Correct.
pill. I'm awful at remembering anything like
Correct.
that. Daily vitamins, I mean anything. So
Correct.
it's already
Correct.
it's
Absolutely.
there.
Well, there's a lot more that we can tackle in 6 minutes, and frankly, I've got about 25 more questions. We
Yeah,
can't
you're
get to
really
those.
into this
But
today.
you have this upcoming webinar. What's
That's correct.
the webinar about?
So the webinar, if you go onto our Facebook page or our website page, you can get information on that as a means to register. So it's free. You get on it. It'll be December 28th, actually. This is a different webinar there. The webinar is going to be on the 28th of December. It's going to be on a Thursday, 6:30. So you register. I will get on the computer. You sign in, and I will basically give a detailed presentation. It's going to be a good 30-minute presentation for you to understand a little bit more about the bioidentical hormones to determine if it's the right thing.
Okay, just to be clear, we popped up that graphic, but that's not the one you're talking about.
Correct. That
Right.
one was for the one that's going on today. I'm going to
Okay.
do one
And
earlier
that
this
was
morning and
about-
tonight, and that's going to be on the Thermiva Thermismooth face
Okay.
we had talked about
Yes,
before.
we have.
Yes.
The other one is going to be on December 28th.
December
Okay.
28th.
So I wanted it after Christmas so people can get
Yep.
through Christmas, and then they can kind of focus on the new year, thinking about your health, trying to get better, feeling good about your body, mind, and body.
Bioidentical hormone, skyndeepmedspa.com. If you want to get to that webinar on the 28th, just want to make sure we reiterate that.
Correct.
Yeah.
Good
I
stuff.
like that it's actually you on there as the doctor responding to stuff too.
Yes,
and
yes,
providing
yes.
that
For
info.
sure.
I really,
Yes.
yeah.
Doctor, thanks for coming on.
Thank you.
Absolutely.
Good
Thank you
stuff.
so much.
Guest of the
holidays.
morning.